And I just need to make sure that I'm not going to be, okay, this is good. So go down all like this, nope, not like that. So okay, we'll just hide the video panel. I don't want to show anybody's face or name on the videos, and I attempt to black those out whenever I do. Okay, so what we're looking at here is a Google Drive, and I'm going to invite each of you to join this folder called MBLEx in Google Drive. And what I'm going to do is send you an email. If you and it'll say Kim Sue has invited you to join this this document or this folder. And inside this MBLEx folder are a whole bunch of documents that we'll be using for the classes. We won't use all of them. Some of them are redundant. Some of them are we won't have time to get to. Most of them are relevant, and rarely is anything not relevant, but some things in there are not relevant. So in the beginning of each class, I'll actually go to the drive and show you, okay, we're working on this document today and this document. These are what we're using. So you should reference those for the class. You should reference this document for tonight's lecture, and you should practice these. So if you have a Google account, you will be good to go when you get the invitation. You just click on it and enter, and there will be no problems. If you have a non-Google account, it may or may not let you in. I have seen some people have difficulty with it with non-Google accounts, even though they're supposed to give you access. If that's the case, you would need to open a Google account or get a Gmail address, and then text me that address, and I'll invite you using that address. So if you go down to FSMTB, you'll find 1, 2, 3 documents: FSMTB e-guide, anatomy and physiology, kinesiology, and then pathology, contraindications, cautions, and special populations. Now, these are the hard science sections of the MBLEx. If we look at the FSMTB website, and we go to the e-study guide, there's 2 guides. There's a paper guide, and then there's a paper guide, and then there's an e-guide. There was an error with the password. Oh yeah, sisters. There we go. What we find through the study guide, just so you know, through it's called the REACH, the Regulatory Education and Competence Hub. What you find through the REACH portal is the study guide, which we're going to look at now, and then they give you 100 questions. After you take the 100 questions practice exam, they'll tell you which ones you missed, and they'll tell you the correct answers, but they don't renew the questions. So you don't get another 100 questions, but you can attempt the practice exam unlimited number of times. And then if you want to purchase additional questions, it's like more expensive, but there's a way to do that in here. I'm not going to go into that now, but the study guide is really, really important. And I'll give you a few examples of why. But when you open up the study guide, you see the welcome section, you can skip that, the getting started section, you can skip that, and then the MBLEx content section. And this shows you the 1, 2, 3, 4, 5, 6, 7, 8, no, 1, 2, yeah, the 7 sections for the MBLEx. Okay, so it's anatomy and physiology, kinesiology, patho. They bundle contraindications, areas of caution, special populations in that. benefits and physiological effects of techniques that manipulate the soft tissues. That's massage techniques, as well as some of the auxiliary stuff that we use, like stones, cupping, client assessment, reassessment, treatment planning, and then ethics, boundaries, laws, regulations, guidelines for professional practice. I would say that for guidelines for professional practice, ethics, boundaries, laws, regulations, and then most of client assessment, reassessment, and most of beneficial and physiological effects of techniques that manipulate soft tissue, it's fine for us to do batteries of questions, although there are going to be some things that I need to summarize and give you as like a study tool. For example, it's nice to have a lot of the massage techniques listed and codified, describing what they do to the body in terms of the first manipulation, how you manipulate the body, and then how the body responds. That's called the mechanical or the primary effect, and then the reflex or the reflexive or secondary effect. But for patho contraindications, we have to go through like medications and how's a diabetic, how are the limbs on a diabetic patient different from others? How's the skin on a Parkinson's patient different from others? Kinesiology, that's how things move, how things are put together, how do they function together? The difference between the anatomical movement and the physiological movement, and then anatomy and physiology, which is the broadest of all the categories. For these hard sciences, we have to actually have lectures. So the majority of our time will be spent on these three, but for each of the 7 sections, you're going to have in the MBLEx folder, copy of all of these sections from the study guide. Presently, there's 3. There's the anatomy, kinesiology, and then pathology. But I'll put the other ones up there pretty soon. So let's take a look just at anatomy and physiology as an example of how they lay the sections out. So it says this header paragraph is actually important because it sometimes describes what you need to know and sometimes describes what you don't need to know, but not always. Just with each of these sections, please read the whole document, read every word. So here it describes the purpose of the section. So it's to assess a candidate's basic knowledge of the systems of the human body, the 11 to 12 systems of the human body, and to recognize irregularities in those systems that may determine the course of the massage treatment for the client. Candidates preparing for the MBLEx should be familiar with anatomical planes, system structure and function, healthcare-related terminology, and then basic concepts of energetic anatomy and tissue injury and repair. They just, in my opinion, took like the broadest things and kind of like put them in a shotgun and fired them at the page. And then the specifics of each system are listed one by one. So circulatory system is listed with the study points. Like this is what you have to know. And for each section, if you go to the Google Drive, you have to enlarge the section, enlarge the screen. For each section, I put green check marks by what we have covered. And where there's no green check mark, you have to go investigate that for yourself. So I have to draw, we have limited time, so I have to like draw lines somewhere. And this is meant to at least help you understand what is being covered in class and what is not covered in class, but still you're still responsible for on the test. Understand also that the tests are randomized. So if the 7 of you, if the 8 of you go into a room and take the test, there probably will be 4 or 5 different question combinations. They may have 100 questions for any section. For like the anatomy section, they may have 100 sections that they can randomize and give to students. And each of you will get, 15 to 20, 25 different questions, different question combinations. So you won't always be asked everything that's in the guide. Circulatory system, they're going to have to choose a percentage of questions to ask you. Same for all the other systems, same for all the other sections. And then under each section, under each system, this is really, really, really important because this saves you a ton of time telling you what you don't need to study. This is areas that are outside the scope of testing. which include the minor blood vessels. So that's like, what's the name of the blood vessels that carry blood to the heart muscle, into the heart? The smaller structures of the heart, individual blood vessels that feed the muscles of the heart. Also, what are the different types of white blood cells? The function of specific white blood cells like eosinophils and basophils. You can see there's overlap among the questions. The cascade of chemical reactions that allow the blood to clot. You don't have to know that. You have to know that platelets function to form clotting, and you have to know, that clotting is also called hemostasis or coagulation, but you don't have to understand the role of vitamin K or other clotting factors in the process. And then in the e-guide, in the e-study guide, they give you 1 or 2 sample questions for each section. And those, unfortunately, 2 questions is not enough to really prepare you for the section. It will give you kind of a flavor of how the questions may be phrased, which can be useful if you're a person who has test-taking anxiety like myself. And then you're on to the next section, right? And the same thing, study points, areas outside the scope of testing, including, and then a couple sample questions. Same for kinesiology. For kinesiology, there's a couple introductory paragraphs, which you definitely should read because they tell you some specific things that you can rule out. Candidate prepared for the MBLEx is not expected to name actions, attachment sites, and innervation for every muscle in the body. In my opinion, that means that you need to be familiar with the actions, the attachment sites for most muscles in the body. Maybe with the innervation, I don't really cover that, but to me, that's an ambiguity that they're leaving that open to give you questions on a few attachment sites, a few actions, but you're not expected to know those for every muscle in the body. You'll benefit from a strong knowledge of muscular anatomy. Again, it's like, of course. And then we're off to the specific sections, and for kinesio, that's components and characteristics of muscle. So that's like what's called histology. That's the cell. What's the muscle made up of? Fascicles, fibers, myofibrils, and then the components of muscular contractions. That's specifically the sliding filament theory, eccentric, concentric, isometric, agonist, antagonist, synergist, prime mover, and then proprioception, locations, attachments, actions, and fiber directions of muscles. See, here's a whole section on it. They just said you're not going to have to know those for every single muscle, but you do have to know them. Joint structure and function, range of motion, passive range of motion. Yeah, and then that's the end of it. And then you're on the pathology, contraindications, areas of caution, special populations. Really want to make sure that you guys understand what resources are available to you being in my class, and also what resources are available to you online. So I'm going to stop the screen share for a minute just so I can see your faces and talk to you guys. And I just want to know if anybody is like really confused or lost or unclear. You need to unmute yourself, Julie.
Link though on the email for the MBLEx.
Say that again, please.
What you were just looking at on your screen. You're going to email us that, right?
I'm going to email you. I'm going to go ahead only because you.
Go ahead.
I'm going to email you an invitation to share the Google Drive.
Okay.
I'm not going to email you an invitation to the fsmtb e-study guide review, but I'll have a copy of the e-study guide in the MBLEx Drive. Do you have a Gmail account, Julie?
Yeah, it's The Truth Stands Forever.
Okay, so you should have no problem accessing it then, as long as you have Gmail or Google.
Yeah, you just haven't sent it yet, right?
No, I haven't sent it to anybody yet. Yeah.
Okay.
And then when you so if we don't have a Google account, we'll just have to make one, and then we should just be able to have access to all that you just showed us.
Yes, you'll have access to everything in the Google Drive, not to the FSMTB website, but part of the e-study guide will be copied and placed onto the Google Drive. If you don't have a Google account, you can try it with your other account. but sometimes it does give people trouble accessing, like the initial
Yeah.
step of getting access. Sometimes Google, they say in their materials, you can access it. You can access shared documents through any account. It doesn't have to be a Google account, but it doesn't appear to function that way.
Okay.
So if you
Okay.
can make a Google account, I would do that.
Yeah, that's fine. I can do that.
Yeah. Are there any other questions?
Yes, I did have a question. In
Yeah.
regards to the checklist that you had, will you also be will you also be having the green check marks on the things that you're going to be covering for each section?
No, I update that. I update that as we go through the classes.
Okay.
Yeah. Any other questions? No? Okay. So you guys are welcome at any point if you have questions during the class. My preference is that you just unmute and call out. I sometimes monitor on my phone as like an extra joiner, just so I can see, because since I'm recording, I don't want to record your faces, right? So otherwise I then have to go back and edit it out. Can you believe they don't pay me for that? I don't understand.
Oh, and
Anyway,
I'm sorry,
so-
I do have another question that just came to
Yes.
my mind.
Yes.
You did mention before that you have a YouTube video, so I was wondering the things that you don't cover, are you going to be having that on the YouTube videos, or this is just access
This is
to it
it.
while we're doing the class? Okay.
Yeah. What if I had my way, I would only do those top 3 sections, and you guys would study the other 4 on your own.
No,
But
that's
I don't think.
the
But
first.
what I have, but when I've done that, people passed everything. They passed those 3 sections and they failed the
Mhm.
others. And
uh,
it's like, ethics is not, look, people fail ethics, and they fail, the effects of massage therapy, and they fail those things, which should be kind of, familiar, because you hear it talked about in classrooms so much. And if you've done an internship or if you've worked with a massage therapist, you see like a lot of basic stuff that they're going to ask you about disinfecting and privacy and, patient safety. But it's still not entirely intuitive. You have to practice it.
No, for sure. The
So-
first 3 were the hardest ones, because I already have
Yes.
my esthetician license. So all the other stuff kind of just,
Yeah.
was understandable to me.
Yes, right. And with your clinical experience or your experience with clients, you have like a ton of knowledge about all those
Mhm.
things that they're going to ask you, and like about best practices and privacy and et cetera, right?
Yes.
But some of those questions, even though they may be kind of ridiculous, you're still responsible for them, and if you miss a question about the business plan, or about like the difference between an online marketing strategy versus a
Mhm.
privacy strategy, then it's still a percentage of your points that you miss. And to be quite honest, it sucks.
Mhm.
Right.
But for sure, if you don't have it like clearly organized in your mind, the body systems and their parts and how the parts work together, that's the anatomy and the physiology. And then how those parts work together in function, that's kinesiology. And then like what happens in the body in abnormal or disease states, and how do you adjust so that you don't cause harm, which is pathology. And that's the basic premise of pathology, is like, how could massage cause harm in a patient who has XYZ, right? If you don't have those, for sure, like you have, in my opinion, you have like less than a 25% chance of getting that question right, because it's totally confusing. But you guys are gonna hate me. You're gonna hate me by like the 5th or 6th class, because I'm gonna have you like doing like range of motion and planes and all that stuff. You're gonna be so stupid. Like, where are we going with this? And then when you get there in the test, you're gonna be like, oh, okay, all right, it's shoulder flexion, abduction. Nobody ever says thank you, but whatever. So if there are there any other questions?
You can come and just shut my door, right?
No other questions? Okay, so I'm gonna mute you guys, and I'm gonna restart the share, and you guys just call out if there's any questions about anything. And we're gonna start with a lecture portion, and then we're gonna take a break, and then we're gonna do some movement. So the reason we do movement to learn our joint ranges of motion, our planes, to learn eccentric, concentric, and all that, to learn body orientations. The reason we do that is because that adds a kinesthetic portion. So you have a visual thing, you have a verbal thing, auditory thing, you have a kinesthetic thing happening, right? And you should be speaking, and I'll cue you for that. I'll say, okay, everybody say superior, inferior, medial, lateral, et cetera, et cetera. So then you have an auditory thing. And as massage therapists, like as clinicians, you should be aware that when you work different parts of your brain, it forces another part of your brain called the association area, right? You have like a visual cortex, an auditory cortex, you have like sensory, and then you have areas between them which blend, the cortices blend the areas together. So when you work multiple areas, it forces your brain to use the association areas, which more solidifies or deepens your understanding, your grasp of the information, which, by the way, happens when you put the information away and you go take a break, and especially when you sleep. So that downtime is really, 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 really important. You should be studying 6 days a week. Take 1 day off, completely off if you can, and get as much sleep as you can. We'll get started. Screen share again. In the future, when we begin our meetings, we'll begin on time. And please be on time. Sometimes I am a couple minutes late. I don't like being late. Sometimes I am late. Please be on time so that you can get everything out of it. All right, we're going to go over these. We're going to refer back to these study guides when we go over anatomy, physiology, kinesiology, pathology, specific sections. But we're going to start with the foundational knowledge tonight, the foundational knowledge, which is going to be body orientation, planes, muscle, joint structure and function. Yeah. And so we're going to start with looking at that stuff first, and then we're going to practice some movement, and then every class moving forward, we'll start with these basics. So this is the document called MBLEx March 2023 Basics. So you guys registered for the class in March, so just remember that class was registered for in March. And when you open up the document, at the top, here's the Zoom link. So this is, of course, is to prevent you guys from not having the link, right? As long as you can access this document, you'll always have the link. And if you scroll down, you'll see that there's a recommendation to review the basics in big bold letters. Big bold letters mean look at this regularly. And then you have non-bold but capital letters, and that's kinesiology. We have planes, joint movements, that should be all caps, right? And then moving further down, we have concentric and eccentric, which is just very short summary. I don't go into that for each muscle. I show you guys that. Agonist, antagonist, synergist, and then I have some seemingly random stuff that's there meant for you to review on a regular basis, to just go through and really drill for yourself. We have some stuff for anatomy and physiology, references for the heart, a bunch of stuff about the muscles and the joints, and we're gonna do the muscles and joints in a minute. So we will look at orientation on the body in a moment, but body orientation means how you get oriented to the body, how you find your way around the body. Like distal, is it proximal, medial, or lateral, anterior, posterior, which also is called ventral and dorsal. And the special terms, like there's a term specifically for the palm of the hand, which is volar, and there's a term specifically for the sole of the foot, which is plantar. You guys, please let me know if the screen starts to flicker. Sometimes that happens if I enlarge it too much, and that just means that I need to zoom out just a little bit. Okay, the planes of the body, those are the frontal or coronal plane, and then the sagittal or longitudinal or median plane, the horizontal or the transverse plane. You can see them over here. Planes can be pretty confusing to people because they use like words in an abstract setting like a sentence, they're just they don't mean very much. Like for the frontal plane, this big purple one, they'll say, what's the name of the plane that divides the body into anterior and posterior? Okay, it does do that, but the real purpose of the frontal plane is not to divide it into anterior and posterior. Like I might even think that's the sagittal plane, the red one here. However, the purpose of the plane is in its movement. Planes are defined by their movement. So the frontal plane really is defined by abduction and adduction, side flexion, lateral flexion. And then joint movements. We're going to go over all of these. We won't do them all every class. We'll cycle through them. So flexion, extension, abduction, supination, pronation, protraction, retraction, elevation, inversion, medial and lateral rotation. Special terms for the wrist like radial deviation, which is also abduction, and we'll cover why it's called abduction. Circumduction, the difference between circumduction and other joints in terms of how the other movements in terms of how the joints are built. And then there's always some links for you guys, some references for you guys to take a look at. Okay. Yeah, concentric and eccentric is the nature of contraction, and we'll look at that in the context of movement. So we're going to start with, believe it or not, we just reviewed planes and body orientation, and we didn't really do joint movements. We're going to start with, let's start with joints, because the joints can be a little confusing in terms of the structure, right? And they give us a lot of information in terms of how they move. So they actually help us to understand muscles better. Okay, let me just make sure that I am recording. Yeah, everything is happening. Great, give me just 1 second. All right. For both joints and for muscles, there's different ways to categorize the joints. So one way of categorizing them is by their structure, right? How they're built, what joins the bones together. Another way of categorizing the joints is by their type, which is to say by how they move or their shape, what movement their shape permits. So it can be really confusing to learn, okay, there are fibrous joints, and those are also called synarthrotic, right? So there's two terms you have to learn: fibrous and synarthrotic, cartilaginous and amphiarthrotic, synovial and then diarthrotic. And that's like enough to be confusing to everybody. Now on top of that, there's the types of joints, how they move, and you have to know that these are all diarthrotic joints, that like none of these are synarthrotic or amphiarthrotic. But if we practice this like just a couple times, it'll be really pretty clear to you. So 3 types of joints: synarthrodial, synarthrotic, which make up joints that are described as synarthrosis. So a synarthrosis is a synarthrotic joint or a synarthrodial joint. An amphiarthrosis is an amphiarthrotic or an amphiarthrodial joint. So arthur, A-R-T-H-R, arthur means, or arthro means bones or joints, and syn means joining, like two that become one piece. It means one piece. So when you hear syn, I want you to think of 2 bones that are joined to form one immovable bone, right? So an example of the synarthrotic joints, also called fibrous joints, or fixed joints. See up here, fibrous joints or fixed joints. An example of the synarthrodial joints are the sutures which are found in the skull. In fact, the skull, the plates, so-called plates of the skull, they actually can move, but they don't move that much. They move a little bit. Just close out a couple applications, so they're not taking up space. So they move a little, but they don't move that much. And then there are other types of joints which are immovable. The dentitions, the teeth, the joint formed by the tooth joining the mandible or the maxilla, so the teeth joining the jaw. Those are called gomphosis. They have their own term, gomphosis. They're also immovable. Syndesmotic joints, they permit very slight amounts of movements. And an example of a syndesmotic joint, which is a type of fibrous joint. An example of a syndesmotic joint is the joint between the fibula and the tibia, which is in the lower leg, and between the radius and the ulna, which is in the forearm. And we'll look at those more closely next time, but yeah, okay, synarthrodial, synarthrotic, synarthrosis. So then anything you want to know, by the way, anything that you want to know, you put it into Google and you search word breakdown, amphiarthrosis, and it'll split it up for you like this, word breakdown. So amphiarthrosis, from amphi plus Greek arthrosis for the articulation, meaning articulation, from arthron, which means a joint. So amphi plus arthrosis, which means joint or articulation. And I want to know what amphi means. So I'm going to do another word breakdown just for am. I misspelled it. Okay, I didn't give it to me. Amphi means on both sides or all sides or double. So syn, meaning like synonym, meaning you could just regard that as meaning one, and then amphi as meaning both sides or all sides or double, meaning double. So syn means one, amphi means double, and di means two, like two separate, right? So one for syn, double for amphi, and then di actually means two separate. So the amphiarthrosis or amphiarthrotic joints, they have a lot of cartilage between them, more cartilage than the fibrous joints. The fibrous joints are joined by fibers. They're joined by connective tissue, and cartilaginous joints have cartilage between them. So if you look at the amphiarthrotic joints, at the amphiarthroses, you see that there are two kinds. Mainly, it's the hyaline cartilage that you find in growth plates. So the joints between the sternum and the costal joints. So the costal joints are the cartilaginous aspects of the ribs where they meet the sternum. And then the secondary amphiarthroses are the fibrocartilage that you find in the pubic symphysis or the intervertebral discs. Now, a lot of you guys don't know what these look like. Maybe some of you may never have seen them in an anatomy book, or may have never looked at them in an anatomy book, but and that is why we are going to take a look at them. So a growth plate. A growth plate is an area of the bone which allows for the bone to expand and get longer as a child grows. That's a growth plate, and that is considered technically an amphiarthrosis. It's considered a type of joint. So that's one part. I don't think that they're going to ask you about that, but you should, just for clarity, know where that is. All right, and then costal joints. We'll just put in the costal joint to see. Yeah. Is a connection between the ribs. Ribs are made of bones and the costal cartilage. So cartilage is not bone. And those look like, those look like this. So these are the ribs, which are kind of grayish, brownish, whitish, right? And then this kind of blue, gray, dark gray. These are the cartilage. So these are the costo. The costo refers to ribs. These are the costocartilage joints, right? And then the joints between the costocartilage and the sternum have another name, which is the sternocostal joints. Sternocostal joints. So that's the joints between the sternum or the breastbone and the costal cartilage, the cartilage of the ribs. So those joints allow for very little movement. If we look at any of the ribs, where the ribs attach to the costal cartilage and where the costal cartilage attached to the sternum, here's the manubrium on top, here's the sternum in the middle, and then the xiphoid process on the bottom. We think of the whole thing as the sternum. In fact, sternum is in the middle. If we look at any of these joints, you can imagine how it would be advantageous to have a little bit of movement between each of these, even if there were no, wrestling or jujitsu or, older brothers who want to torture you. Even if none of that ever happened, falling off a bike, still you can imagine that just the process of your lungs expanding and contracting would need some give in the rib cage that wraps them. And that's what amphiarthrotic joints are meant to do. And then so those are the primary amphiarthrotic joints, also called cartilaginous joints. Those are the primary ones. And then the secondary ones that also permit slight movement. I mean, by the way, it says it's immovable hyaline cartilage, for example, growth plates, comma, first sternocostal joints. I don't agree with that. I think all the sternocostal joints and the costocartilage joints, which is like the joints between the ribs and the costal cartilage, that both of these two joints here on either side of the costal cartilage permit some movement. That has been my observation clinically. Like you can feel when those things slip out of place a little bit, but with experience. So it's not that these are immovable. No, they are not immovable. They're mostly immovable, but they're not immovable the way that fibrous joints are, the way that synarthrotic joints are. They permit some movement. There's a lot more movement in the secondary amphiarthrotic joints, the secondary cartilaginous joints. And those include the joints between the vertebral joints. So actually I should be putting in the intervertebral joints, because that's really, there's more joints in the vertebrae than just the intervertebral joints. There's also the sternovertebral joints, the costovertebral joints. So if you look at any drawing of the vertebrae, you see the body of the vertebrae. I'm starting by getting us oriented, right? We always get oriented first. You start with the body of the vertebrae. On the back of the vertebrae is the spinous process, and the back surface of the body would be here. And then on the sides of the vertebrae are I'm sorry, I'm distracted. On the sides of the vertebrae are let's see, spinous process and the transverse processes. I'm sorry. Hey Max, don't lift heavy, right? Got it? He's unsupervised, so I didn't know he was going to lift. I would have. So the transverse processes and then the spinous processes, right? And then between the body of each vertebrae, there are discs. We all know there are discs in there. Some of us think initially that the bones are the discs, that the body of the vertebrae is the disc. No, that's not the case. The bones are separated and cushioned by a ring of cartilaginous material. there's a soft center in there, kind of like jelly donut sort of concept, but there's cartilaginous material that cushions and separates the vertebrae and allows them therefore to move. And the vertebrae move in almost all directions. They side bend and they move, they flex and they extend. They also slide forward and back. They slide left and right a little bit. Sometimes they slide and they get stuck, or they twist and they get stuck. And that's one of the things that you guys can help to fix by undoing, for example, the spasm or the chronic tension that comes with bones are out of place, and then allowing some greater range of motion. They often put those things back on their own. So fibrous joints, aka synarthrosis, synarthrodial, synarthrotic joints, and immovable joints, two bones becoming one, joined by fibrous structures. Those are the sutures of the skull. Those are the gomphoses, which are the teeth joining the jaw, and the syndesmotic joints, which are the joints between the ulna and the radius down here, and the fibula and the tibia in the lower leg down actually throughout the whole length of those bones. And then cartilaginous joints, also known as amphiarthrosis, amphiarthrodial, amphiarthrotic joints. Cartilaginous or amphiarthrotic joints allow for some movement. The primary ones are between the harder middle portion of the bone and the softer portion of the bone in a young person, and that line is called the growth plate. That's actually a cartilaginous area that allows the bone to expand, allows cells there to multiply so the bone can expand. And then the sternocostal joints. So the joints between the sternum and the costal cartilage, and in my opinion, also between the costal cartilage and the ribs. And the secondary joints are fibrocartilage, filled by fibrocartilage. So that's the joints between the vertebrae, the intervertebral joints that we just saw, and then the pubic symphysis. So if we look at the pubic symphysis, we see that it is a ring of cartilage similar to like the same concept as intervertebral disc. And again, let's get oriented. So we have the top and the bottom, or the superior and the inferior portion of the pelvic bones. On the top, you have the ilium, which has the iliac crest on the front and the iliac crest on the back, posterior iliac crest, anterior iliac crest. And then on the bottom, you have the ischium, like the ischial tuberosity, also the sit bones. So it's the ilia, the two ilia on the top, and the two ischia on the bottom, ilium and ischium singular. And then joining at the bottom, joining each ischium, joining the two ischia together is the pubic symphysis. It's a cartilaginous disc, and it allows for quite a lot of movement. There are two cases where you will see movement where the two halves of the pelvis twist in opposite directions, or one twists one way and the other stays, and it gets stuck, and there's a lot of pain at the pubic symphysis. Two cases. One is where there has been a fall with some force, like a kid riding on his or her bike, and they fall right on that long bar, and the pressure goes oftentimes not right in the middle on the pubic symphysis, but a little bit to the side, which wrenches one pelvis a little bit forward or a little bit back. I've also seen that happen to some firemen who fall on bars getting off of the truck that way. And then the other thing you'll see is after childbirth, where the hormone relaxin has made all of the soft tissue in the body really, really flexible, and as a result, the two halves of the pelvis are moving in a way that's like really a lot more movement, and then the body tightens up, but no one has bothered to say, hey, do this stretch or this movement, or go to get a massage, or go see a chiropractor or an acupuncturist, and make sure that the things are not spasming, and then go to yoga class and put things back, so those are the amphiarthrotic joints. Okay, and then the synovial joints, you know what, it's 7:08. Let's take a break, come back at 7:18. We'll do synovial joints, and then we'll do some movement. Okay, so come back at 7:18 Eastern time, 7:18 Eastern time.